Hello, Seagulls. Before we get started with today's briefing, I ask that you join me, wherever you are, in a silent moment of reflection. The world is a dangerous place, and many people have died recently in shootings, in hurricanes, in fires, from COVID, and particularly the 13 brave soldiers who were killed last week in Afghanistan. These young warriors were not much older than many of our students, and I ask you to join me in a moment of silence to show our gratitude for their service. Thank you. You know, I was out and about last week and on move-in day, and you could just feel the campus coming alive again. I'm so excited to see our students back on campus and back in our classrooms. Over the course of this pandemic, we've been committed to providing the most normal university experience for our students while maintaining the safest campus environment possible for everyone. And that includes our students, faculty, and staff, as well as our surrounding community. We've achieved this by frequent testing, in-house contact tracing, and robust safety protocols based on the best available science and the advice of medical and public health officials right here on our campus. More recently, we've been able to add vaccines as a tool in our fight against COVID-19. In April, the University System of Maryland issued a vaccine mandate for all students, faculty, and staff. As a member institution, this mandate applies to all students and employees at Salisbury University, except for those who have been granted medical and religious exemptions in accordance with federal and state laws. In the spring, we announced that all unvaccinated students and employees, regardless of exemption status, would be required to test twice per week in order to maintain access to campus. And our university health team continues to feel strongly that this frequency of testing is an effective way to monitor and slow the spread among those that are unvaccinated on our campus. On Sunday evening, we made an announcement that any student or employee without at least one dose of the vaccine will lose access to campus as of this upcoming Monday, September 6th. While this announcement is consistent with the University System of Maryland mandate, it does take us in a different direction than the one we anticipated, and that's because of some changing factors of this virus. First, the Delta variant is a more contagious and more highly transmissible variant of the virus than we had previously seen. Case rates are still rising nationally in Maryland and in Wicomico County. Second, a larger number of students than we anticipated, mostly those living off campus, are either unvaccinated or have yet to complete their consent forms. Third, this virus is spreading more quickly among children, and those under 12 do not have the opportunity to protect themselves with the vaccine. Many of our students and employees are parents with young children, and this is troubling. We must be able to effectively respond to cases of COVID-19 and provide the healthcare services necessary to keep this campus as safe as possible. And we cannot do that if we have a high number of unvaccinated students and employees on this campus. I've said from the start of this pandemic that we would always follow the advice of the experts, and that's why I'm accepting the university health team's recommendation that any student or employee that has not received at least one dose of the vaccine by this Friday, September 3rd, will lose access to campus until they get that first shot, or they receive an approved medical or religious exemption. All our protocols have tried to balance public safety with personal freedom. But the fact is that we must take the steps necessary to protect all members of this campus community and do our best to provide the best possible university experience for our students. I know that you will have questions. And Dr. Karen Olmsted, the university's chief academic officer, is here, as is Dane Faust, our vice president for student affairs. First, I'm going to introduce Karen, and then my chief of staff, Eli Maudlin, is going to step in and answer some of the questions that come in to stay informed. Thank you for everything that you all have done to continue to protect the flock. Here's Karen Olmsted.
Thank you, President Wight. And I just want to underscore that we're constantly evaluating and reevaluating operations here at Salisbury University, make things as safe as possible. I get a lot of questions about instruction here on campus, and so I just want to underscore that a lot of what we're talking about over the last few days is really focused on students and employees here at our main campus, or at the University System of Maryland at Hagerstown, USMH, or at the universities at Shady Grove, RSU students there. If for students who are in online programs or for employees who have 100% telework, you might not be impacted by some of these more recent policies if you don't ever need to come to campus. Regarding instruction, again, I get asked about that a lot. Students are expected to comply with all of our expectations as outlined here and in the Return to Campus Guide and the many communications that you get. I think it's important to note that faculty every day receive an updated roster in their courses, and it indicates whether or not a student is cleared to come to class. If the student is compliant with our requirements, there is no highlighting on their name and they're cleared to come to class. If a student's name is highlighted in yellow, that means that student has a medical reason for not being cleared to come to class, and faculty have been asked to work with them as they would any student who has a medical reason for missing class. Students have been getting sick before COVID, and our faculty have worked with them in the past. For students who are not compliant with university policies for whatever reason, they show up on faculty rosters as gray. And so if that's the case for you, you need to mitigate whatever reason is keeping you from being cleared to go to class, whether that's getting a test or being vaccinated or whatever the reason may be. Please comply with your faculty members' request to leave class if you haven't been cleared to participate that day. Last Tuesday, Dane Faust, the Vice President for Student Affairs, and I sent an email out to all students updating them on various things. And one thing we noted was that faculty have designed their courses for the modality in which they're intended to be delivered. So face-to-face courses might have a different design than online courses. Faculty who are teaching face-to-face courses are not expected to deliver instruction remotely to students who would prefer to receive it that way. If you prefer remote courses, then you should register for those. So if you do need to miss class due to an illness or other life event, please talk to your faculty member and consult the syllabus about how to do that. Or we also have an emergency absence policy that's available to you in that email, again, that was sent on August 24th or last Tuesday. Given the pandemic, the university reserves the right to change our plans of operation at any moment based on best information that we have at the time. And so if we did need to change modalities of some courses, faculty might need to change their syllabi, their ways of assessing students, and so on. We really hope that doesn't happen, but it might be a possibility. We've also asked faculty not to change the modality of their courses as they're currently listed in GullNet until such time that we need to do so. And again, we hope that that doesn't happen. We're very proud of the fact that 75% of our sections are being delivered as face-to-face courses, and we really look forward to delivering those in a very engaging and safe manner. For employees, faculty, and staff that are part of academic affairs or partners with academic affairs, will be holding a town hall this evening at 7:30 at our usual virtual meeting spot. An email about that went out yesterday afternoon. And finally, mask up. That's one of our best lines of defense against the pandemic. So I hope to see you around campus in a mask.
Thanks, Dr. Olmsted. I'm going to go ahead and try to address some of the many questions that have been coming in to stay informed now. The first question, or first of many like this, is about the Sunday announcement, and I would just echo Dr. White's remarks about the Delta variant and this being in line with the USM, that's the University System of Maryland, mandate paired with the number of students that we have on campus that have yet to complete their consent form. We do hope that once those consent forms come in, those numbers increase. what's the mask policy is a question, and that is that for the time being, all students, employees, visitors, and guests to the campus are required to be masked while indoors. And that is unless they're eating or drinking in a designated dining area or in a private office or space. So that's when they're alone in an office or space like that. A lot of questions came in about ramifications for employees if they remain unvaccinated without an exemption. What will happen? And I would just say that as of this coming Monday, they would lose access to campus. So this applies to those who need access to the physical campus in Salisbury. They would lose that access. Beyond that, I think that's a question for the supervisor or HR. If they are unable to do their job function as a result of them losing access, and that's absolutely something that they need to speak with their supervisor about. This parent is asking about the charge for carryout from the dining commons. And this is actually an initiative from the Student Government Association. The sustainability group implemented a new process by which students and employees could pay a one-time fee for a reusable carryout tray from the commons. So this is something that they bring back and forth from the commons when they carry their meals out. So this is very different than the carryout structure that we had to have last semester. This is a sustainability effort. And again, it's a one-time fee for you to be able to carry your food out of the commons. There are a lot of questions here about what type of leave, whether it's sick leave, personal, annual leave to use if you miss an appointment or are non-compliant otherwise. I would say for employees with these questions, they should reach out to their supervisors, and supervisors should reach out to human resources for further instructions and details on how all of that should be dealt with. This question is about open house and what COVID mitigation strategies will be in place. I would say that depends on the situation on the ground at the given open house. Certainly mask wearing, as the provost just mentioned, will continue. Obviously frequent testing of members of the SU community that are present, and certainly other safety protocols will be in place depending on the space and the time of that open house. This person asks what they should do if they were a recent close contact. Can they schedule a campus test? And I know a number of questions have come in about testing vaccinated individuals, given that we're already testing unvaccinated individuals twice weekly. The current tests that we are using are not approved for asymptomatic testing of vaccinated individuals. We understand that there is demand for this, and the university has procured 2 different types of tests that will be made available to the entire campus population, including those that are vaccinated. As it stands now, is our policy that even vaccinated individuals that are identified as close contacts should come in for testing 3 to 5 days after that exposure. And if you have not reported that exposure to a nurse, you should report that to campus health, and a nurse will schedule you for that test. But we will have the capability to schedule asymptomatic vaccinated individuals for testing, and that will be announced to the campus community in the coming weeks. So these are more, I think I've answered some of those questions about the testing. This person asked, why are the rules different for quarantine periods for someone that's vaccinated versus non-vaccinated? I think a medical professional would tell you that there's a much higher risk for the unvaccinated, but certainly our policies reflect those of the CDC as well as local and state public health officials for our quarantine protocols as it relates to vaccinated versus unvaccinated individuals. This person is asking about the turnaround time for a test to be loaded in a GallNet so that a student can go to class. Depending on the time that a student takes a test, it could take up to 3 hours for that test to result in a change. However, if a student maintains their twice weekly testing regimen, if they continue to make their test on Tuesday and Thursday, they will not go gray. So if they miss a test and they have to make up that test on a non-Tuesday or Thursday, then it could be, and this depends on the time that they test, up to 3 hours for that change to be reflected. However, if they continue to test, if they make their Tuesday, Thursday test, then they will not fall out of compliance and will remain cleared in that roster and with their gall card and all the other things that go along with testing compliance. Do you take into account someone who has recently tested positive for COVID? The nurses certainly take that into account when they're doing contact tracing. Absolutely. What percentage of students are unvaccinated? What about staff? We are going to actually make sure that these numbers are on the COVID dashboard once we have a good number of the consent forms in and we know who's actually on campus. What I can tell you, just from memory, the last time I looked at the numbers is I know that we have roughly 98% vaccination among our residential students. I believe the number is above 95% for employees that have provided their consent form. And I know we still have some ground to make up for our off-campus students, but I believe that number was even in the 80s with still trying to get a number of consent forms in. That's 80%. To what extent do professors know the student's vaccination status? That is not visible in a roster. What faculty see, as the provost mentioned, is whether a student is cleared or not for campus based on their compliance, and that compliance could be with testing policies or the vaccine mandate. And if a student is highlighted as yellow, then they are medically not cleared for campus, but they cannot see a student's vaccination status in the rosters. Someone asked what they do if a missed test. If a student misses their test or employee misses their test, they can show up on Tuesday or Thursday between 6 to 6:45 p.m. The doors close at 6:45 p.m. And there are Monday, Wednesday, Friday testing makeup options. Each student and employee has one of these makeups per semester. That information is available on the testing website with greater detail about site hours. Professors are not required to excuse an absence of a student that misses their test or falls non-compliant otherwise. What about exemption requests? Exemptions are handled through human resources for faculty and staff and through student health services for students. And this is consistent with how all vaccine exemptions have been handled at the university. What are the metrics that need to be met in order for the indoor mask mandate to be removed? The university health team is looking at this weekly and hopes to have a better sense of where we stand as a campus, particularly as it relates to vaccinations within the next week and a half to 2 weeks. And they will look at all of the metrics available. That includes regional rates, hospitalizations, as well as on-campus vaccination rates, on-campus positivity rates, how the contact tracing process is working, and all of those things to make those determinations. And that's going to be something that's ongoing throughout the semester. How many students tested positive on the initial testing day? This is also available on the dashboard, but I believe there were 6 positives out of more than 900 tests on a move-in day. What is the visiting policy? Are students allowed to have friends overnight? If this is specific to housing, I would point you to the Return to Campus Guide for Students, or talk to housing. As it relates to visitors more generally, they're supposed to screen and, of course, wear masks and follow the other safety protocols that are in place for the rest of the campus community. This is asking about the mandate in general, I think. And I would just suggest, as the president did, that the university health team, the university's administration, are taking every step possible to ensure the safest possible campus, and being in line with the University System of Maryland's vaccine mandate is certainly one of those steps. If someone is unvaccinated but receives an exemption, would they be green and or cleared, or would they be red? That person would be cleared as long as they maintain compliance with the testing protocols, which are twice weekly, Tuesday, Thursday. They would remain clear in GallNet without any restrictions. What about students from overseas? So we are working with students overseas that want to be vaccinated in the United States because they do not have vaccines currently approved by the World Health Organization. If they are currently overseas, certainly this mandate only the vaccine mandate only applies to those that need on main campus access. But if you have international students that wish to get vaccinated in the United States, they can certainly work with Campus Health to do that. The last question is about the vaccine clinic being held tomorrow. So we're holding a vaccine clinic on campus tomorrow in partnership with the Wacomico County Health Department. That clinic will go from 9 a.m. to 3 p.m. All 3 vaccines are being offered, and those that are currently eligible for the 3rd dose are also able to get that on campus tomorrow. So please check your email. That information is also on the website. I believe it will go out on an email attached to this briefing as well. But all 3 vaccines will be offered on campus tomorrow, as well as a 3rd dose for those that are eligible. And it is open to the public. Family, friends, loved ones, and members of our community are welcome to come to the clinic tomorrow. And I'm going to wrap it up as far as questions. And please, if you have any remaining questions, stay informed at salisbury.edu.